My name is Abby Hodges and I am a radiology technologist, and today we will be focusing on the aspect of interpreting scans from a CAT scan. While rad techs do take x-rays, MRIs, and CTs, they also help radiologists interpret scans. Today we're going to focus on analyzing images when it comes to being a radiology technologist. Before we start, there is a common misconception between radiology technicians and technologists. Technicians mainly focus on prepping the patient and taking images, while technologists do the same thing but are highly skilled in interpreting the scans alongside radiologists. So today we have a 20-year-old male who was in a motorcycle accident. He was brought into the ER and was experiencing nausea, headaches, and dizziness. So they brought him up for a CT scan. A CT is a type of x-ray that takes sliced images and reconstructs it into one giant image. So we're going to take a look at the scans over here. As you can see, there is a whitish area right here, which is pretty abnormal compared to the rest of the image. This white area is known as a bleed or a hematoma. It's a buildup of blood. The bleed is located between the dura mater right here, which is the outer membrane of the central nervous system, and the skull right here. This is known as an epidural hematoma, epidural being the location of the bleed and hematoma being the brain bleed itself. This bleed is most likely due to the trauma of hitting his head on the ground after falling off his motorcycle. Previously, we focused on CTs. There are 8 additional types of radiologic technologies. The first one being an ultrasound, which is also known as sonography, which uses high-frequency sound waves to capture live images from internal structures. The second one is an X-ray, which uses radiation to penetrate or pass through the body to produce shadow-like images of internal structures. The third one is MRIs, which uses magnetic fields and pulses of radio wave energy to make pictures of internal structures. The fourth one is nuclear medicine, which uses medical imaging that uses radioactive material to take images of tissues and organs in the body. The radio tracer shows activity and function of tissues and organs. Fifth is radiology therapy, which is therapy using ionizing radiation, which is usually used as part of cancer treatment to control and kill malignant cells. The sixth is cardiac catheterization, which a catheter is inserted to an artery or vein in your arm, groin, or neck and threaded through your blood vessels to diagnose and treat cardiovascular conditions. The seventh is mammography, which is just an x-ray of the breast. And the final one is fluoroscopy, which is usually described as an x-ray movie where a contrast dye is put into the body and the x-ray videos the movement of that dye. And those are the 8 different types of radiology technologies, and that's it. Thank you.